this hearing is a little bit like putting lipstick on a pig, and that's kind of disrespectful to the pig. But you can call this whatever you want, but at the end of the day, the big bad betrayal bill kicks 16 million Americans off of health care, and all so that you can deliver a giant tax break to the billionaires. And so I want to talk about this thing you're calling fraud in Medicaid. We all care about getting rid of waste, fraud, and abuse, but you don't fight fraud by punishing the poor. You fight fraud by going after the entities that commit fraud. And so, Mr. Gordon, in your experience, what's a bigger problem? Individuals fraudulently on Medicaid or private companies trying to extract improper payments from the government?
The scope of fraud by insurers and by providers vastly outstrips the scope of fraud by individuals, orders of magnitude. So we haven't talked about Medicare, fraud, abuse, whatever you want to call it, about $85 billion in 1 year, differential, upcoding, other practices in Medicare Advantage. In Medicaid, the vast majority of fraud, and this shows up in reports from DOJ, from the Inspector General, who, as people have pointed out, has historically been a nonpartisan official. She was there for 25 years until she was fired. Reports from those sources, very clear, it is fraud by providers, doctors, practices, et cetera.
That's right. So vast majority of fraud in Medicaid is by providers. So if you wanted to go after waste, fraud, and abuse in Medicaid, you would go after the providers and not the patients who need care. Does the Republican betrayal bill do anything to actually attack that place of the vast majority of fraud in Medicaid provider fraud?
I'm not aware of that. I'll say there was a time when Congress invested more in program integrity initiatives by HHS and DOJ, and these are tough, and they save $4 for every dollar spent.
That's right.
They go after the people. They go where the money is, not where the people in need are.
Those fraud units and the inspector generals that actually root out fraud that have been fired by this administration. In the big bad betrayal bill, what happens when people lose coverage? When those 16 million people lose coverage, what happens? Where do they go?
Well, they probably don't get preventive care because it's no longer covered. And then if they get very sick, they probably go to the hospital and it becomes uncompensated care, which is often borne by taxpayers anyway.
Right, so they end up in emergency rooms at higher taxpayer cost, and that burdens hospitals as well, which is why they're trying to put a hospital fund into the Senate bill, because they're kicking people off of health care, but they realize that they're going to need to go somewhere to get care. So it sounds like kicking people off of Medicaid doesn't save money, it just shifts costs elsewhere, correct?
There certainly is a large cost shift, yes.
Okay, and do you think that this big bad betrayal bill, I want to make sure we call it that every time because big bad betrayal is what it is. Do you think it could lead to a more efficient administration of Medicaid, or is it just going to create more red tape and logistical issues and errors?
I don't think it will lead to more efficiency, no.
Now, I want to talk about work requirements quickly, because the nonpartisan Congressional Budget Office that estimated the 16 million people are going to lose their health care, a lot of those people are losing their health care due to the barriers from these newer and stricter so-called work requirements. I'm putting that in air quotes. Republicans are trying to say, hey, we're not denying people health care. We just want to have work requirements to make sure that they are working in order to get health care. So what percentage of people on Medicaid who are able to work are already working?
If you exclude people with disabilities, it's about 2/3.
The vast majority are already working. I want to ask you about Arkansas. You mentioned it in your testimony because Arkansas proved that work requirements don't increase the number of people who work, they just increase the number of uninsured. So in 2018, Arkansas became the first state to implement work requirements for adults who were enrolled in Medicaid expansion. Did that lead to an increase in employment?
No.
And who was kicked off of Medicaid and why?
About 18,000 people, generally for procedural reasons because of bureaucratic issues.
And would you say that there are people who are able to live off of Medicaid alone? Like, is it desirable to avoid working so that you can be enrolled in Medicaid?
Nobody lives off Medicaid.
Nobody lives off Medicaid. So just to be clear, this is a big bad betrayal bill that strips Americans of 16 million Americans of health care, all to deliver tax breaks for the wealthiest.